right, today I'm going to administer some medications to a patient. Right now I'm at my med cart outside of the patient's room, and I'm going to start by just gathering my supplies. So I have my med, the cup to administer, some hand hygiene in the water, which would be in the room, gloves and things like that, and my scanner to check everything over. I'm going to start by looking. Today we're administering atorvastatin and calcium. I'm going to check if the patient has any allergies, which on my chart it says no allergies. So I'm just going to look at all those things, make sure that the order and the medication look correct to what I have and what is on here. And that completes my first check. I am now going to do some hand hygiene. Oh boy, that didn't work very well. All right, I am going to review the adverse effects, any nursing considerations, any dosing, normal dosing rates, everything like that. Consider the appropriateness of administering the medication to this patient and make sure that everything checks out for my patient there. Some adverse effects include like muscle and joint pain, insomnia, a headache, things like that. So I'm now going to go ahead and get some gloves on. If I can today. Okay, so since my medication is in a package, I'm not going to open it until I'm at the bedside, but I am going to pull out 2 of them because these are 10 milligrams, and on here it requests a dose of 20 milligrams. So I'm going to get those ready along with my cup. I'm going to do a check again, just like the milligrams by mouth, orally. This is just reviewing the chart, making sure everything looks good. And at this point, I'm ready to head into the patient's room. In this case, since I'm taking my med with me, I put all these other meds in my cabinet and I lock my cabinet up, make sure that safety protocol, and now I'm gonna head into my patient's room. There's no door, so I don't need to change my gloves. All right. Hi, Jonah, my name is Sophie. I'm gonna be your nurse today. I'm here to administer your medication. We're administering atorvastatin today. Can you tell me your name and your date of birth? Perfect. I'm also going to scan your barcode. Let's see if it'll work for us. Let's try a couple times. My thing is loading. All right, we're going to try a couple more times because it didn't verify my patient. Let's see if this one worked. Nope. Does not want to scan my patient. I'm going to try and refresh one more time, see if I can get it to work, and if not, we'll move on. Okay, it's not going to work right now, but that's okay. I'm also going to scan the medication in what would be a normal situation, and since neither of them are going to work, I'm now going to do my 6 rights. I'm going to make sure that I have the right patient, which I did confirm with the wristband and the patient identifiers, that I have the right patient. I have the right medication, which is atorvastatin, calcium, and same on here. The right dose, I have 2 10 milligrams, and I'm doing a 20 milligram dose today, orally or PO by mouth, which is how we'll administer today, which looks great. And the right reasoning, and then the right time, which I am within the 30-minute time limit. So I'm now going to prepare my medications in the cup. And while I do that, I'm going to ask my patient, do you have any allergies to medications? No allergies? Great, okay. And then do you have any issues or difficulty swallowing? No? Wonderful. Okay. If I can get this pill to come out in the cup for me. All right, I have my 2 pills and my water. I am going to make sure that the patient is seated in an upright position. Not all the way upright, just comfortably enough that they can take these meds safely. I am going to administer some water first. There's that. Make sure they get the pills and some more water. And I'm just going to make sure, perfect, did you swallow? My patient did swallow their medications at this time. This medication is for cholesterol levels. It's to help maintain or try and lower those cholesterol levels. So just try and avoid any high cholesterol foods. And then I'm gonna monitor my patient about 30 minutes after, come in and check and make sure that there was no difficulties when they took the meds, make sure that everything looks good there. I'm gonna lower my patient down to an appropriate level, perfect, all the way down, and just make sure that they're comfortable and safely in bed. I'm gonna come back to my computer, and what I would do is document this, which I will document at this time, and I think we are all set. I'm gonna take my gloves off, put them in the garbage, do some hand hygiene, and I'll come see you in 30 minutes.